Officials in New Jersey held a hearing this week as they look for answers as to why 11 kids died in an adenovirus outbreak at a health facility in the state. More than 30 children were infected from the outbreak at the Wanaque Center in northern New Jersey, and all the kids that died had compromised immune systems. New Jersey's Department of Health found some issues with hand washing among the staff.
The owners of the Wanaque Center did not show up at the hearing. They said that they will cooperate fully, though. But a public hearing is not an appropriate setting because of patient privacy laws. So with us now is Democratic New Jersey State Senator Joe Vitale. He's also the chair of the New Jersey Health Committee that led this week's hearing. And we spoke to you prior to the hearing, so welcome back. As we mentioned, the hearing was 2 days ago. So I have to ask you, what was your biggest takeaway from it?
Well, the takeaway was that there was a breakdown, not just in communication, but there's a breakdown in following the protocols, where it is that you take care of these very medically fragile children. And so whether it was at Wanaque or a university hospital in Newark, where 3 children died recently, there was a significant breakdown in protocols. Now, I saw some reports that the commissioner brought forth to the committee, where the inspectors reported on some of their observations at Wanaque. Even after all of this has happened, they still had staff going from patient to patient to patient, not changing gloves, not washing hands, handling equipment and other things before they even took care of sanitizing themselves, and potentially passing germs on from kid to kid to kid. So they still don't get the message, right? And so we don't fully understand that. But he was very thorough in his report to the committee. We have some recommendations going forward. After we meet with him and he concludes his report, but maybe how to change the reporting and the accountability system and some enforcement elements. But I think all along the way there was a breakdown in protocol. Some of the witnesses also raised the issue of this was a financial decision by Wanaque, that these children were kept at the facility longer than they should have before they were transferred to a hospital where they could have been cared for sooner. Because once they leave the hospital to go the facility to go to a hospital, they lose Medicaid dollars to the tune of $512 every day. And so they looked at this, I believe, in some ways as a financial decision, not to treat these kids sooner, not to test them sooner, and not to care for them sooner.
That's disgusting.
Yeah.
It's even more disgusting
awful.
Than, what you describe as some really basic sort of lapses in protocol, I would say.
Yeah, I mean, Senator, let's just, for our audience, provide a little bit of a timeline. The last time we spoke, the outbreak began on September 26th. The Department of Health was notified by the Wanaque facility 13 days later. The health commissioner says, due to that protocol that Anne-Marie was just talking about, he was notified 10 days after that on October 19th. And by then, 5 kids were already dead and a dozen more were infected. So during the hearing, the commissioner said he changed that protocol so outbreak notifications will become immediate. Is that enough? What's your reaction to that?
Well, that's a great first step, and unfortunately we had to wait for something like this to happen before they made those kinds of changes. But he's a smart, good commissioner, and he gets this. He's a doctor, and he's not taking any prisoners on this issue. So I think that's the right move to make. There are other things that we can do going forward in terms of separating children when they're first diagnosed, where there are symptoms of an illness, particularly with this kind of population. But the issue with Wanaque is they tell us that they didn't have the room to separate these kids. That being said, they've hired, a high-powered attorney. They're all lawyering up, whether it's a university hospital or Wanaque, so they can protect themselves against lawsuits. They haven't been transparent. They didn't respond to our invitation to appear before the committee until the day of the hearing. And it wasn't even testimony. It was just, we can't be there. Our dog ate the homework. So it was just an awful response from both the hospital and from Wanaque.
So listen, Senator, Wanaque officials say we are participating, contrary to what you just said. But listen, we have to protect patient privacy. There are very strong, federal and state laws protecting health information about our patients. And that's really the only reason that they didn't come to this hearing. What's your take on that?
Oh, that's just not true. I mean, it's true that there are patient protections. There are HIPAA violations that you could run afoul of, or laws you could run afoul of if you do the wrong thing. They don't have to be specific to patients. They don't have to mention patients' names. But you can talk about the processes and the systems and the employees and the oversight and the leadership at the facility. You can talk about how it is that they maintain their infection control protocols. What are they doing to improve them? They don't have to talk about patients specifically, a patient's name, whatever happened to them. That would be a violation. But their lawyer wrote a good letter. But it's just really trying to pull the wool over everybody's eyes in terms of what their accountability is.
So the family members of some of the children who died were also there. And of course, your heart goes out to them because we all know that there's nothing that can be done to bring their children back. So I guess the question for them and for us and for our audience is what are the next steps for you and the Health Committee to protect these patients at all New Jersey facilities from outbreaks like this? Because this could happen, in other areas and have popped up in Voorhees and Newark.
Well, I think one of the first things we'll do is to wait for the commissioner to conclude his report, which should be in the next 2 or 3 weeks. So he'll outline in very grim detail, very specific detail, what happened and why it happened, in his view, and then what recommendations he would suggest to the legislature or make internal policy changes in the department. I don't think that it's possible to eliminate any poor outcome for a child who is so medically compromised and fragile. Anything can happen. We're not sure that in Newark, one of the children who died was a result of the virus they had. They were premature, were born after 4 months of gestation. So anything could have an adverse outcome or effect on a child, but to have the strongest possible measures in place where you have enforcement all the time, where leadership, where quality, where infection control is of the utmost importance, it's on everyone's mind all the time, and you literally have someone that's dedicated to making sure 24/7 in facilities like this, with populations like this, that they're there to ensure that all employees follow the rules. CNAs, RNs, LPNs, custodial staff, everyone follows the rules, and they're watching like a hawk all the time.
State Senator Joe Vitale, as always, sir, thank you so much for helping us understand this and providing some clarity. We appreciate it.
Thanks a lot. Thanks, Anne Marie.